In February last year, Patricia Dowd, seen here on the left, collapsed from what at the time was thought to have been a heart attack. Further investigation concluded she had in fact succumbed to COVID-19, the first death in the US to be officially linked to coronavirus.
I saw her on the floor, and at first I just grabbed my phone and I called 911. They said that she was the first person. I was like, I don't think she was. I think someone had it before her. Like, this can't be happening to my family.
Virtually every country in the world has suffered during the pandemic, but the United States has been hit the hardest. The most infections and the highest death toll, the scale of which is almost beyond comprehension. This is the Vietnam War Memorial here in Washington, D.C. The names of the 58,000 Americans who died in that conflict are etched into the black marble. Now, this is 75 meters long. If you had a similar tribute for the COVID victims in this country, you'd need one 9 times the length. And of course, more and more people are dying every single day. But could more have been saved? A report by the Lancet Commission suggests that bad policy, as much as bad luck, may have contributed to the US's unenviable statistics. It says 50,000 public healthcare jobs have been cut since 2002. It highlights that 30 million people don't have health insurance. And it estimates that if American death rates had matched those of other industrialized nations, the US would have had 40% fewer coronavirus fatalities.
I think many of these deaths could have been avoided. There's been many missteps. The public health system in the US really failed this once-in-a-lifetime pandemic. Prevention and maintenance and so on. The country was not ready.
The Biden administration has pledged to radically improve the nation's response to the virus. The rate of vaccination in particular is being ramped up. But tackling the underlying factors that have made the US so vulnerable to the pandemic won't be so straightforward.
In many ways, this is a wake-up call. It's a wake-up call on the front of the reality of health disparities and what it means when we have a market-based system that doesn't adequately invest in all of our citizens.
What seems certain is that whether the US health system is eventually reformed or not, there'll be many more American families grieving for loved ones before this crisis is over. John Brain, TRT World, Washington.